Miss Vici?
Yes.
Hi, I'm Natalie Clark. I'm one of the physician assistant students working with the clinical team today. Do you care if I ask you a couple questions and examine you?
No.
All right. Can you verify your date of birth for me, please?
3/16/98.
Okay. What brings you in today?
I'm having really bad abdominal pain.
Oh, man.
Yeah.
When did that start?
It started about a month ago, but I just felt like I should come in because it's getting progressively worse now.
Okay. So it has been worsening.
Yeah.
Just like abruptly, or has it been gradual?
It's been gradual. It comes and goes. It's really bad when I eat, though. It
Okay.
really hurts.
So eating worsens the pain.
Yeah.
Okay. Does anything improve the pain?
When I don't eat, I really try not to now. I feel like I've lost a few pounds because every time I eat, it just is like a burning, like.
So you've had some weight loss.
Yeah.
Okay. So eating triggers the symptoms to worsen, correct?
Mm-hmm.
Is there anything that triggered it, like, initially when it came on, like, gradually?
No, I just kind of felt it one day and I didn't think too much of it, and then gradually it was just getting worse. Yeah.
Okay. Have you had similar pain before?
Never.
Okay.
Yeah.
Can you describe this pain for me?
It burns kind of when I eat. It just like it hurts so bad. I just.
Okay. Does it radiate anywhere?
No, it pretty much stays right here, but sometimes it does hurt when I'm pooping also.
Okay. So
Yeah.
a little pain with defecation. All right. Can you rate this pain on a scale of 1 to 10?
Probably about a 7.
Okay. So pretty severe.
Yeah.
Okay. Is the pain constant, or does it come and go?
It's pretty constant at a low rate, but when I eat, it really spikes up more.
Okay. So it's not really associated with like day or nighttime, or
No,
it's really
no,
just
it's just
associated with eating.
Yeah.
Okay. And you said some weight loss, pain with defecation. Is there anything else going on?
I feel like nauseous
Okay.
a lot of the times, and like I'm just out of it. Like I feel fatigued or.
Okay. So have you noticed any so have you vomited at all?
Yeah, I've
have
been vomiting. Yeah.
How have your bowel movements been?
So they're painful and it's like diarrhea. They're
Okay.
a little runny.
Have you noticed any black or bloody stools?
No.
So no.
Well, it's a little bloody. Like I see blood sometimes.
Okay. And you said you don't have history of the same pain. And the pain has made you eat less.
Yeah.
So you had a little bit of decreased appetite. Okay. Do you have any family history of similar symptoms?
No. My dad had heart disease, but that's about it.
Okay. So, okay. Any allergies that you're aware of?
Not that I know of.
Okay. So, do you take any medications daily?
I take birth control.
Okay. Oral? Injection?
Oral.
Okay. Do you know the name of that?
Minastrine.
And the dose?
I don't know the dose.
Okay. And how many times a day do you take it?
Just once.
Just once. Okay. And you said it was oral?
Yeah.
All right. Do you use any home remedies or non-prescription drugs? Take any vitamins?
Sometimes I take Advil.
Okay. All right. And do you have any known allergies? You said no.
No.
Okay. Now I'm going to go into your past medical history. So as a child, how was your overall health?
I was really healthy as a child.
So no chronic childhood illnesses like asthma or diabetes?
No.
Any specific diseases like measles, mumps, rubella?
No.
Any chickenpox?
No.
Scarlet fever?
No.
Rheumatic fever?
No.
Diphtheria?
No.
Whooping cough?
No.
Polio?
No.
Okay. And now as an adult, have you had any history of high blood pressure?
No, but my dad does.
Okay. Any high cholesterol?
No.
Coronary artery disease?
I actually, when I was born, I had a heart murmur,
Okay.
and I just outgrew it, so no coronary
So
artery
no.
disease now.
No murmur currently?
No.
All right. Any history of COPD or asthma?
No.
Any cancer history?
No.
Any thyroid disorder?
No.
Any kidney disease?
No.
Hepatitis?
No.
HIV? Okay. And have you had any surgeries in the past?
I did have a dermatologic. It was like a wart removal on my foot. That was it.
Okay. Do you remember when that was?
That was when I was young, like a kid, like
Okay.
probably 8. I don't
Okay.
know.
And was it just at like your dermatology office?
Yeah.
Okay.
Oh wait, I also did have my wisdom teeth removed too.
Okay, when was that?
That was last summer, 2018.
Okay, and do you remember the name of the hospital you were at and the doctor?
I can find that out for you.
Okay.
I'm not sure.
Okay. And any complications afterward?
One of the stitches didn't stitch all the way, and I just had to go back, but
Okay.
that was fine.
But long term, you were doing okay?
Yeah.
Okay. And then for your gynecologic history, when was your last period?
It was about a month ago. I should be getting it soon.
Okay. And have you ever been pregnant?
Never.
Okay. And you said you're on oral contraception. And how is your sexual function? When was the last time you had intimate physical contact with someone?
Sunday?
Okay. Does that include sexual intercourse?
Yes.
Okay. And do you have sex with men, women, or both?
Men.
Okay. And do you use protection?
Well, I take birth control. That's
Okay,
about
so
it.
that's your form of protection. All right. Do you have any concern for STIs or HIV or AIDS?
No.
Okay. Do you have history of any psychiatric illness?
Never.
Okay. So you've never seen a counselor or psychotherapist?
Never.
And never been on medicine for psychiatric reasons? Do you have any history of accidents or injuries?
One time I sprained my finger.
Okay. How'd you do that?
I was playing Foursquare, you know
Okay.
that game with the
Yeah.
ball. Yeah, I hit my finger.
Oh no.
But it was fine.
It was fine.
Yeah.
Did you get any treatment for it, or did
I
you
just they
kinda
put a
little splint on it?
Yeah.
Okay. And your finger's okay now?
Yeah, it's doing great.
Great. Good. Glad to hear. Have you ever been hospitalized?
No.
Okay. That's good.
Yeah.
And then are you up to date on your immunizations and routine screenings?
Well, I didn't get a flu shot yet this year, but I got one last year.
Okay. So you're up to date on your tetanus,
Yes.
pertussis,
Yes.
diphtheria,
Yes.
polio,
Mhm.
MMR,
Yes.
measles, mumps, rubella.
Yep.
Varicella?
Yep.
And you're gonna get your yearly flu shot soon.
Yeah.
Hep B,
Yes.
Haemophilus flu B.
I don't know really.
Fair enough. Pneumococcal.
I don't know if I've gotten that since I was a kid.
Okay. And meningococcal,
Yes.
herpes zoster,
Yes.
and your HPV vaccine.
Yes.
Right. And have you had any tuberculosis screenings, like a PPD test?
Yeah, I actually had to get one for school.
Perfect. And that was negative?
It was negative,
Okay.
yeah. All the ones, I've gotten a few and they've all been negative.
Okay. So have you had any pap screens?
No.
How about mammograms?
No.
Colonoscopies?
Mm-mm.
Okay. So you
Yeah.
may have to,
Maybe do that one.
Yeah. or have you had any fecal occult blood testing?
No.
Okay. Maybe in the near future, but we'll see.
Okay.
And have you ever had your cholesterol tested?
No.
Okay. Now I'm going to ask you a little bit your family history.
Okay.
I'm going to consider 2 generations above, 2 generations below, and your siblings.
Okay.
So consider, since you don't have any children, consider just your grandparents, your parents, and then your brothers or sisters.
Okay.
All right. So, any history of high blood pressure in your family?
Yeah, my dad has high blood pressure,
Okay.
and his parents both had high blood pressure.
Okay. And is your dad? So your dad's living,
Yes.
and
my
is
dad.
he? How old is he?
My dad, I think he's 58.
Okay.
Yeah.
And your grandparents?
My grandparents, his parents are both deceased.
Okay.
One from heart problems, and one is from a car accident.
Okay. So there's some coronary artery disease.
Yeah.
In the grandparents.
She had like a triple bypass surgery, I'm pretty sure, yeah.
Okay.
But she was still smoking, so then, yeah.
Okay. So she was a smoker. Any high cholesterol?
My dad has high cholesterol.
Okay. My dad too. You said coronary artery disease for your grandparents. How about your
Yes.
your parents?
Not that we know of, not
Okay.
yet,
Okay.
or ever.
Any diabetes?
No.
Okay. Any history of lung disease or asthma?
Not that I know of, really.
All right. Any tuberculosis?
No.
Any cancers in your family?
So my mom's side's a little more cancerous. My aunt had a very benign breast cancer,
Okay.
And then my mom's parents, they don't have it, but their parents did. Like, I think it's within, I'm not sure what they had, but it was in, like, the family line that my aunt developed a little.
Okay. So, really, your parents haven't had any cancer, your siblings haven't had any cancer?
No.
And then your grandparents?
Haven't either. Yeah.
Okay, just your aunt.
No.
Okay. Any kidney disease?
No.
Any thyroid disorders?
Actually, I think my mom does have a kidney problem.
Okay.
I'm not sure exactly what it is. She had like a pacemaker. I'll get back to you on that one.
Okay. Any headaches?
No.
Any seizure disorder?
My brother actually
has seizure disorder.
Yeah, he has epilepsy.
Okay. Noted. Any strokes?
No.
How about arthritis?
No.
Is there any mental illness that runs in your family?
No.
Is there any suicide or substance abuse?
No.
Okay. And is there any genetically transmitted diseases?
Not that I know.
Are there any allergies that you're aware of that run in your family?
Mm-mm.
Okay. And has your family had any similar symptoms that you're presenting with today?
No, I'm really the first who's ever had like really bad abdominal pain. Usually it's heart disease that's running through, so I'm not sure what's going on.
Okay. All right. Now I'm going to ask you a little about your social history. So where were you born?
Long Beach Island.
Okay. And how was your childhood? How would you describe it?
It was good.
Okay. No issues?
No.
Good. And how many years of schooling have you completed?
I've gone up to my bachelor's in college.
All right. And your occupational history, past and present?
I am an ER tech at Elena Care, and I used to be a party host at a trampoline park.
Oh, fun.
Yeah.
That's fun. So you're not retired yet?
No.
And how's your home situation?
Good.
You live at home with
my parents.
Your parents?
Still.
All
Yeah.
right. Okay. Do you have any siblings living with you still?
My brother.
Any pets?
A dog.
Bibs. And do you use safety precautions around the house? Do you feel safe?
Yeah.
Okay. And then your mode of transportation, do you use
I drive.
vehicle? Okay.
Yeah.
And are you single or?
Yeah.
Okay. Do you have any sources of stress now within the past 6 months or over your lifetime?
Probably PA school.
Okay. I could see that being a little stressful.
No other chronic stressor.
All right. Have you ever been in the military?
No.
And how's your financial situation?
Well, I have a little student debt, but that's about it.
All right. And how do you enjoy spending your free time?
I really like to work out.
Okay.
I work out a lot, I guess.
It's a good
like
stress
play
relief.
soccer. Yeah. Watch TV, hang out with my friends.
Great. And any issues with your activities of daily living, like bathing, eating, dressing, any continence?
Mm-mm.
Okay. And what is your religious or spiritual beliefs, if you have any?
I'm Catholic.
Okay. And then you said you like to exercise, so
Mhm.
how many times a week do you typically exercise, and what do you do?
I probably exercise like 4 to 5 times a week.
Nice.
I usually just run
Okay.
and stuff like
Great.
elliptical. Sometimes yoga.
Okay. All good stress relief. And what does your daily food intake look like?
I try to eat whole foods. I'm trying not to eat processed foods anymore, so I think I have a balanced diet.
Okay, good. And how about your liquid intake?
I just drink water and coffee.
All right.
Maybe some wine.
Okay. It's okay.
Yeah.
Occasional wine is
Yeah.
good. And how many cups of coffee a day do you think you drink?
Just 1. I try to limit myself to 1 a day. Only on school days too, but sometimes
Okay.
it's like 2.
Okay.
You know,
1 to 2. And how have your sleeping habits been?
Good.
No trouble falling asleep?
No.
Okay.
Not at all.
And then safety measures. Do you typically wear your seatbelt?
Mm-hmm.
Use sunscreen?
Yep.
Do you wear helmet?
I don't wear sunscreen that much.
Okay.
Okay, sorry.
Okay. We'll have to talk about the risks of melanoma and skin cancer
Okay.
without use of sunscreen, but we'll get to that after the history. Do you have smoke detectors in your home?
Mm-hmm.
And did you say you wear helmets when you ride your bike?
I don't.
Okay. And do you have any locks on your cabinets for medicine and chemicals in your home?
No.
Okay. And what is your sexual orientation and practices?
I'm straight.
Okay. Do you use any alternative healthcare practices?
No.
No, like herbal supplements or...
Sometimes I sniff lavender.
Okay.
Yeah.
All right. Do you feel safe at home? Do you have any, like, I know you said you were single, but, like, do you feel any partner violence in the past? Or
no.
history of, okay. And then now I ask all my patients this, any tobacco use?
Never.
So you've never smoked. Okay. Do you drink alcohol?
Yes.
Okay. How much alcohol do you drink?
I don't know, like a glass of wine.
Like a day, a week?
I probably drink like at least 1 glass a week. I only really drink 1 day of the week if I do.
Okay.
Probably a glass or 2.
Okay. So it's wine and it's just like your typical...
Wine, or sometimes I like twisted, or not twisted, those spiked seltzers.
Okay.
Oh, they're good.
Okay, they are good. And then, do you use any illegal drugs?
No.
Have you ever?
I have like smoked weed before.
Okay. When was the last time you smoked weed?
Sounds like high school. It was
Okay.
just one time, and
So
I
it's
don't
been
know.
a while.
Yeah.
Okay. Have you used any drugs that are not prescribed to you?
No.
Okay. And then, do you take any more than the prescribed amount if you were to have any drugs in the past?
No.
Okay. All right. So this next part may seem like 100 questions, but it's important that I don't miss anything.
Okay.
So I'm just going to go kind of from head to toe.
All right.
So recently you said you've seen like a recent weight change, correct? With
Yeah.
the pain and not eating as much because of the pain. Have you noticed your clothing to fit more tightly or loosely?
It's a little more loose now.
Okay.
Yeah.
Have you had any weakness?
Yeah, I told you earlier I was a little fatigued.
Okay,
I
so
guess maybe I feel weak too.
Okay. Any fevers?
Yeah, they've been on and off.
Okay. For your skin, have you noticed any rashes, lumps, or sores?
No.
Any itching?
No.
Or dryness?
No.
Any change in color?
No.
All right. Any changes in your hair or nails?
No.
Any changes in mole size or color?
No.
Okay. Have you had any headaches?
No.
Dizziness?
No.
Lightheadedness?
No.
Any vertigo?
No.
And any recent head injury?
No.
And just take into consideration I'm going to ask over the past 6 months, have you had any of these symptoms?
Okay.
So it doesn't have to really just be with the complaint today.
Okay.
How's your vision been?
It's been good.
Any double or blurred vision?
No.
How about any spots, specks, or light flashes?
Never.
All right. Any pain, redness, or excessive tearing?
Mm-mm.
Do you wear glasses or contact lenses?
No.
Any history of glaucoma or cataracts?
No.
All right. And when was your last eye exam?
Not for a while. I just never needed glasses.
Okay, that's good. Consider yourself lucky. How has your hearing been?
My hearing's fine.
Any ringing in your ears?
No.
Any vertigo?
Mm-mm.
Any earaches or discharge?
No.
Any recent ear infections?
No.
Okay. So you've had no decreased hearing, so you don't use any hearing aids or
No.
assistive devices. All right. Have you had any recent nasal stuffiness?
No.
Any discharge?
Mm-mm.
How about nosebleeds?
No.
Or frequent colds?
No.
Okay. Any sinus trouble?
No.
Any history of hay fever?
Never.
Okay. Have you had any frequent sore throats over the past 6 months?
No.
Any hoarseness in your voice?
Mm-mm.
Have you had any dry mouth or soreness to your tongue?
No.
All right. Do you have any dental issues? Any bleeding gums or
No.
issues there? And you don't wear dentures, I assume?
No.
Okay. When was your last dental exam?
I actually go on Thursday.
Oh, yay.
Yeah.
Okay, good.
So 6 months ago, I guess.
All right. For your neck, have you noticed any swollen glands?
No.
Any goiter?
Mm-mm.
Any lumps?
No.
Any bumps?
Mm-mm.
Any pain or stiffness in your neck?
No.
Okay. And then do you perform regular self-breast examinations?
No.
Okay.
I don't really know how to do that.
Okay. I'll have to educate you
Okay.
later on. Any lumps, pain, or discomfort that you've noticed, even though you haven't really done any self-exams?
No.
Okay. Any nipple discharge?
No.
All right. Any recent cough or sputum?
No.
How about any shortness of breath?
No.
Any wheezing?
No.
Any pain with, like, breathing or inspiration?
No.
Okay. Have you had any chest x-rays in the past 6 months?
I don't think I ever have.
Okay. And you denied history of any like lung problems, so no asthma, bronchitis, emphysema, pneumonia. All right. Any chest pain or discomfort?
No.
Okay. Even with this belly pain, you haven't noticed any pain up into your chest?
No, not my chest, just my lower abdomen really hurts.
Any palpitations?
No.
Any shortness of breath?
No.
You said no to that. Do you use any pillows at night to ease breathing?
No.
Do you need to sit upright to ease breathing at night?
No.
Okay. Have you noticed any swelling in your hands, ankles, or feet?
No.
Do you have any history of heart trouble?
I just had that murmur I told you about.
Yes.
Yeah, but I outgrew it.
Okay. So no history of high blood pressure, you said. You outgrew the murmur. Have you had any past EKGs or cardiovascular testing?
I did have a whole EKG done a few years back, just to like undiagnose the heart murmur.
The murmur.
Yeah,
So
it's probably in my records.
Okay. But otherwise, no cardiac testing. Okay. So with your GI, you did mention that you have some nausea, vomiting, pain with defecation. Any constipation with it?
No, the opposite.
So it's just excessive diarrhea?
Yeah.
Okay. Do you have history of hemorrhoids?
No.
Any food intolerance recently?
Yeah. Well, not intolerance, it's just that I don't want to eat.
You don't want to eat?
Yeah.
Any excessive belching or passing gas?
No.
Do you have history of jaundice, liver, or gallbladder problems?
No.
History of hepatitis?
No.
Okay. So have you had any recent intermittent leg pain, like when you walk or exert yourself?
No.
How about, so no leg cramps?
Never. Well, sometimes I get like Charlie horses.
Okay.
Yeah.
Okay. On the occasion. Do you have history of varicose veins or past clots in your veins?
No.
DVT? Okay. And you said no recent swelling in your calves or hands and feet. Any change in fingertip or change in color in your fingertips or toes in the cold?
Maybe. I don't know.
You just haven't noticed?
No, I haven't taken
dramatic?
any notice.
Okay. And have you noticed any swelling with redness or tenderness to your extremities?
No.
How has your, have you had any urinary symptoms? Any frequency with urination?
No.
Any pain with urination?
No.
Any blood in your urine?
No.
Okay. Have you had the urgency to urinate more frequently?
No.
Excessive urination at night? Is there any kidney or flank pain associated with the pain that you're experiencing? Any suprapubic pain?
No.
Or ureteral colic?
No.
Okay. Any incontinence?
No.
Do you have history of UTI or kidney stones?
No.
Okay. All right. Have you noticed any vaginal discharge?
No.
Any itching down in the vaginal area? Any sores?
No.
Or lumps?
No.
And you said no history of sexually transmitted infections?
No.
Okay. And you have never been pregnant? And you're on oral contraceptives. We went over your sexual habits. Do you have any pain with sexual intercourse?
No.
Okay. And when did you start your menses, your menstrual period? At what age?
I was probably like 10.
Okay. And since then, has it been pretty regular? Or?
Since super regular.
Good. With the birth control helping?
No, it was just always regular.
It's always been regular?
Yeah,
Okay.
I just use it as a,
Okay. As a contraceptive. How long do your periods typically last?
5 days.
Okay.
Yeah.
And is the bleeding heavy?
It's usually heavy,
Okay.
but the birth control helped that a little bit.
Okay. Have you noticed any bleeding in between your periods or after intercourse?
No.
Okay. And you said you're almost due for your next period.
Yeah,
Okay.
should be any day.
Is there any like excessive cramping or pain before you start your periods?
There is, but that's another reason why I take the birth control.
Okay.
Yeah, so it's helped with that.
Okay. So you're not menopausal, and you weren't born before 1971, so you have no concern for that. Have you had any recent muscle pain or joint pain?
No.
Any muscle or joint stiffness?
No.
Do you have history of gout or backaches?
No.
Okay. Have you experienced any neck or low back pain recently?
No.
All right. Now I'm going to ask you a little bit about your psychiatric history. Do over the past 6 months, I should say. Have you felt nervous or tense?
No.
Have you had any mood swings or changes?
No.
Have you felt depressed at all?
No.
Any memory change?
No.
Have you had thoughts of harming yourself or others?
No.
Okay. Have you ever had any suicidal attempts?
No.
And you said you've never required counseling or psychotherapy because you haven't really had any history of psychiatric illness. And you said no recent changes in moods. How about your attention or speech?
They're normal.
Okay. Changes in orientation, memory, insight, or judgment? All right. And you said no to headaches, no to dizziness, no to vertigo. Have you had any recent fainting or blacking out episodes?
No.
Okay. Any focal weakness or paralysis in your limbs? Or
No.
face? Any numbness or loss in sensation?
No.
Any tremors or involuntary movements have you noticed? That you
No.
noticed? Great. And you denied history of seizures, correct? All right. And then have you noticed yourself to be like bruising or bleeding more easily?
Mm-mm.
Do you have history of anemia?
No.
So you've never required like a blood transfusion?
Never.
Okay. Do you have you said no history of thyroid trouble, correct?
Yes.
All right. Have you had any recent heat or cold intolerance?
No.
All right. Excessive sweating?
No.
Excessive thirst or hunger?
No.
Any polyuria?
No.
Or change in glove or shoe size?
No.
Okay. So that concludes the history. I'm going to go talk it over with my colleague, and then I'll come back with some more information.
Okay.